is Brandon McDonald. I'm a physician assistant student with the University of Pittsburgh. I'm here to perform a musculoskeletal exam on you today. Is that okay?
Yep.
Before we get started, can you confirm your name and date of birth for me?
My name is Beth Magyar, and I was born on July 2nd, 1993.
Great, thank you. So I'm dressed professionally. I would have a name tag on if I had one. I've performed hand hygiene. Beth is seated on a bed right now, but if she was on an exam table, I would make sure that the exam table had a clean piece of paper on it. She's dressed and clothed right now. Normally I would expose the areas I was examining, but for the purpose of this exam, I will keep her clothed. Okay, now we will move on to the physical exam. We're starting with her TMJ, so could you look at me, please? I'm going to inspect and palpate anterior TMJ joints bilaterally. Open your mouth for me. Good, close. I've already seen her open her mouth. Now could you wiggle your jaw side to side? Good. Could you stick your bottom jaw out further than your top? Good, thank you. Now we'll move on. Could you stand up and face me? Good. Move on to the C-spine. We'll inspect and palpate the cervical spinous process. I'm just going to fix this here. Good. So palpate the spinous process of the cervical spine, the paraspinal muscles, and then the bilateral sternocleidomastoids. Good. We'll do the same thing on the T and the L spine. So palpate and inspect the thoracic spinous process, onto the lumbar spinous process, and then the paraspinal muscles in the T and the L spine. And then as well as her SI joints. Okay, good. All right, now we will assess range of motion. So for your cervical spine, look down to the floor, look up to the ceiling. Good, now come back to normal. Bring your ear to your shoulder and ear to your shoulder on the other side. Good, now come back to normal. Now twist your head and twist the other way. Good. Now put your arms at your side. Let me see you bend over and touch your toes. Good. Come back up to normal. Now extend backwards. Good. You can come back to normal. And now twist one way without moving your legs too much. Twist one way. Good. And now put your arms at your side and bend one way. And then bend the other way. Good. All right. Now we'll move on to the physical examination of the shoulder. So I will inspect and palpate the shoulder anteriorly, posteriorly, and laterally. I'll start by palpating anteriorly with the SC joint. And then going along the clavicle to the AC joint, and going along the back to the spine of the scapula, and then to the bicipital groove here, and to the greater tubercle, and then to the coracoid. Good. Now I'll have to perform some range of motions. Good. I would normally do this bilaterally, as with all the other joints I'll be examining in the future, but for the purpose of the exam, we'll just do this unilaterally. So could you pick one arm up all the way over your head? Good. And now come back and extend it behind you. Good, and now come back to normal. Bring it up to the side. Good, you can come back to normal. Now bring it up and across your body. Good, come back to normal, just like I am with your elbow bent. Now twist out. Good, come back to normal and twist in. Good, you can have a seat for me now.
Okay.
Now we'll move on to the physical examination of the elbow. So I'll start by inspecting and palpating the medial and lateral epicondyles, the olecranon process, and then the distal biceps tendon. So this is the medial epicondyle. This is the lateral epicondyle, this is the olecranon, and then the biceps tendon. We'll form some range of motion here, so could you bend your arm up, could you extend it, and then could you turn your arm over, and turn your arm back. Good. Now move on to physical examination of the hand and wrist. So I'll start by inspecting and palpating the distal radius and ulna, underneath her watch here, the anatomical snuff box, all of her metacarpals, 1 through 5. Good, and then the proximal, the middle, and the distal phalanges, as well as the metacarpal joints, the proximal interphalangeal joints, the distal interphalangeal joints, and then the interphalangeal joint of her thumb. Also, as part of my physical examination for the hand and the wrist, I would palpate the carpal bones, all 8 carpal bones. Good, and I'll have her perform some range of motion. So let me see you can do one at a time. Extend your wrist, good, come back down, flex your wrist, and then bring it to normal. Twist it to one side, good, twist it to the other side, good. And then for your fingers, let me see you open your hands up nice and big like this, spread your fingers apart, bring them closer together, and now extend your finger, flex your fingers, make a fist, good. All right, now we'll move on to physical examination of the hip. So could you stand up for me? Good, we'll start by inspecting and palpating the hip, starting with the ASIS. Good, that's right there, and then the greater trochanter, good. I'll move on to some range of motion, so could you bring your knee up to the ceiling like this? And then you might want to turn and face the camera. Good. And then could you bring that same leg down and back, extend your hip? Good. I'm just going to fix this here too. All right, good. You can face me now. Yeah, now bring your leg up like this. Twist it out like that. Twist it in. Good. Come back to normal. And now bring it to the side. So that's abduction, and then bring it across to the other side. That's adduction. Good. You can have a seat for me. Now we move on to a physical examination of the knee. So I'll start by inspecting and palpating these different landmarks. I'll start with her patella. Then moving on to her patellar tendon and the tibial tuberosity, and medial and lateral joint lines, medial and lateral collateral ligaments, and then medial and lateral femoral condyles. Good. And now we'll assess some range of motion. So could you kick your leg out? Good. And now bring it in. Try to tuck it underneath you. Good. Okay, good. Now move on to a physical examination of the feet and ankles. I'll start by inspecting and palpating the ankles here. Could you take your sock off for me? I'll start with the distal tib and fib. Good. I'll move on to the tarsal bones. Good. The Achilles tendon in the back. Tarsals, metatarsals, all 5 metatarsals, and then the proximal phalanges, the middle phalanges, and the distal phalanges, as well as the proximal interphalangeal joints, the distal interphalangeal joints, and then the interphalangeal joint of her great toe. Also, as part of my examination for the foot and ankle, I would inspect and palpate her metatarsal phalangeal joints. Good, and then we could move on to range of motion. So could you bring your toes up towards you, extend down, bring your foot in, bring your foot out. Now just your toes, if you can, squeeze them down and then push them out. Good. If I found any abnormalities or asymmetries with active range of motion, I would move on to passive range of motion. I would do all these examinations on her joints bilaterally in terms of her shoulder, elbow, wrist and hands, hip, knee, foot and ankle. That's the end of the examination. I'll let the patient know that the examination is now concluded. I will perform hand hygiene, make sure that the patient is appropriately dressed, make sure the room is clean, and then leave the room. Thank you.